I'm the Manager of Data and Impact at the DENTAQUEST Partnership for Oral Health Advancement. I'm here to talk today a little bit about teledentistry. As we know, with the COVID-19 crisis, teledentistry has really expanded greatly, going from very little use to a lot of use nearly overnight. But there's a lot then that is unknown, including how patients and providers really feel about teledentistry. So I'm here today to talk about two surveys that we performed that really show the extent to which patients and providers support teledentistry. So the first is a survey of providers that we here at the DENTAQUEST Partnership conducted of 37,000 DENTAQUEST participating providers. We covered a range of topics not previously covered and focused on Medicaid and safety net providers. One of the things that we then asked questions about was about teledentistry. We found that nearly half of all dental practices and providers strongly or somewhat agree that telehealth tools are more important than before in the pandemic, and they use them for screening and seeing patients when they can't see them in the office. We also found that 27% of reporting providers are seeing patients via telehealth platforms. This is a significant increase from less than 10% just a year ago. And another 13% are planning on using it soon. Providers also think that these telehealth tools are here to stay. Providers anticipating long-term changes in dentistry due to the COVID-19 crisis are nearly 100% more likely to use telehealth or virtual platforms in their practice. As well, younger providers are more likely to use telehealth platforms. Telehealth utilization stays constant over the survey period, reduces just a little bit, but not much, during this whole April to June period that we surveyed, indicating that even when practices are returning to work, telehealth is still something that practices are going to use. We think that patients are likely to want to continue to use it, as patients who are at risk due to underlying health conditions can seek telehealth options for receiving dental care. So we think in addition to providers wanting to use it, patients are going to demand it. We have some direct evidence of this. We partnered with Advantage Dental from DENTAQUEST to conduct a survey of patients' experiences with teledentistry. 465 patients aged 18 and older who had a synchronous teledental visit through Teledoc with an Advantage Dental provider in May of 2020 were contacted, with 111 responding to the survey. Patients liked it. They direct patient quotes that it's really quick and easy. 86% of patients said they would use teledentistry again, and another 86% would recommend teledentistry to another person. Patients reported it made it easier for them to seek care. It allowed them to avoid cancellations or missed appointments because due to things like driving distance, work, or needing to get childcare. But they still reported being able to get access to in-person care if they needed it. So in summary, we find that both patients and providers really like teledentistry and think that it's likely to continue. We have a variety of teledentistry resources available on our website. I would encourage you to go look at that. It's dentaquestpartnership.org. In addition, we're conducting ongoing research on the efficacy and safety associated with teledentistry. And so more to come. If you have questions on any of this research, feel free to reach out to me via email. My contact's on the screen. Thank you.